Hello, my name is Brianna Garcia, and today I will be presenting information about the importance of adequate micronutrient intake from foods and dietary supplements during the pregnancy. Prenatal nutrition. Prenatal nutrition can be defined as the nutrient and weight gain recommendations before and during the pregnancy. A good maternal diet from food intake and supplement use helps sustain pregnant women throughout the pregnancy with energy, supports fetal development of tissues and organs, and prepares the body for postpartum lactation. Expectant mothers who refuse to follow the dietary guidelines are putting themselves and their infants at risk by not meeting their nutritional needs. Research. A survey conducted by the March of Dimes organization found nearly two-thirds, 63% of women were able to classify folic acid as an essential vitamin. Additionally, less than 40% of women listed iron, which is 36%, calcium, 33%, and vitamin D, 29%, as nutrients which may aid in reducing the risk of having an infant born with a birth defect. 84% of females who proclaimed to be familiar with folate were either unaware or stated an inaccurate recommended amount of the vitamin. This shows that many women are just unfamiliar or lack the knowledge about vitamin nutrient supplementation, as well as the importance of these nutrients during the pregnancy. Evidence from the 2001 to 2014 National Haynes and Nutrition Examination Survey found roughly 70% of pregnant women aged 20 to 40 years old were taking their recommended prenatal vitamins. The report found 10% were not meeting the recommendations of vitamins D, E, A, C, folate, iron, and calcium, and over 95% were exceeding their sodium intake. A more recent study showed only 30% of women consumed a folic acid supplement a month prior to becoming pregnant. The Prenatal Health and Nutrition Survey conducted in 2017 found 34% of pregnant women started taking a prenatal vitamin or multivitamin prior to conception. This shows that many women are not fully preparing themselves prior to becoming pregnant, not by choice necessarily, but because of lack of education as well too, and knowledge. Inadequate nutrient intake from foods and supplements can cause a lot of harm to not just mom, but also the infant as well. For the mother, it can cause her to develop gestational diabetes mellitus, preeclampsia, iron deficiency anemia, lead to excessive weight gain, especially if the mother is not eating a well-balanced diet, and cause nutrient deficiencies, in particular folate if they're not taking the recommended prenatal vitamin. Now for the baby, it can lead to the baby being born at a small or large for gestational age, so that affects the birth weight. It can also lead to preterm delivery, put them at risk for insulin resistance, affect their immune system, and lack of folate also can lead to birth defects in the baby. And once again, if the mom is overweight during the pregnancy, it also increases the risk for obesity for the child as well too, and later on and during their adolescence and adulthood. Proposed intervention. So my proposed intervention will incorporate the preconception and gestation phases. The ideal target population for this intervention would be women of childbearing age, women intending to become pregnant, and expectant mothers in the preconception phase. In the preconception phase, women will be taught the fundamentals of nutrition education. So for example, the recommended dietary intakes for food groups, in particular grains, fruits, vegetables, proteins, both from non-meats such as seafood, eggs, peanut butter, and then including meats and chicken and pork, etc. They will learn which nutrients are important for fetal development, specifically calcium, iron, and folic acid. And then they will begin taking a prenatal vitamin or at least the woman's multivitamin to better prepare the bodies for the pregnancy to come. This then will lead to behavior change strategies, which will hopefully focus on improving preconception health behaviors, motivate them to make dietary and lifestyle changes, and increase their enrollment in family planning organizations, cooking classes to help give them ideas of ways to make those dietary changes. And then for families that are food insecure, enrollment in WIC or SNAP would also be beneficial as well. Finally, in the gestation phase, there would hopefully be early establishment with prenatal care, especially in the first trimester, education on food safety, the benefits of breastfeeding, as well as weight gain recommendations to make sure that they're not exceeding their weight gain or going under as well. The life course theory looks to the past and the future experiences over the lifespan. It recognizes that some developmental stages can have a greater influence on future health outcomes than others. Timing refers to the critical period or the sensitive period occurring from childhood into adulthood. The lifespan development states an individual's health today is the cumulative effect of everything that happened leading up to today, such as a mother's health and behaviors during preconception or pregnancy. Human agency states individuals make choices that affect their own health. By implementing the principles of timing, lifespan, and human agency from the life course theory into the proposed intervention, it will result in improvement for the health outcomes for pregnant mothers and their children. Timing. So timing, we want to kind of incorporate that more in the preconception health period. Pregnancy may not be the best time or the appropriate time to change poor eating habits and implement prenatal vitamin intake. Changing the behaviors of consuming unhealthy foods that are high in saturated fats, sodium, and sugar can be quite challenging. So ideally, in the preconception phase is the best time to prepare women and their bodies for having an infant. We want to focus on making sure that they're taking their recommended prenatal vitamins or women's multivitamins, focus on nutrition education and sources of foods, as well as eating a balanced diet. Human agency can kind of lean more towards both the preconception and the gestation period. For this, we want to focus on education and access. So education on the impact of nutrients on the body, referral to nutrition assistance organizations such as maternal health clinics, and public health education programs that can counteract the concern of nutrient deficiencies during the pregnancy. Enrollment in family planning organizations, WIC, SNAP are really excellent sources for moms. So we want to be sure that she does have access to these programs and is aware of them, or at least given the referral. And then lastly, the lifespan, that kind of plays into the delivery of the infant and the health of the child later on in life. So the quality of life and diet during the pregnancy does build a strong foundation for the health of children and adolescents. The maternal diet can shape the health and metabolism of the child. So what a mom eats during the pregnancy can definitely impact her child later on, by putting them at risk for obesity or preterm delivery, or on the other end, it can result in a very healthy child. And then children also pick up the dietary habits of their parents as well too early on. So by seeing the mom eat these healthy foods, healthy vegetables, a variety, foods from all colors of the rainbow, it'll help them to develop those eating healthy habits early on, so that way they can take them on into their adulthood and then pass them on to their future children as well too, and so on. In conclusion, a good maternal diet is instrumental to the health and development of a human being. Previous efforts have failed to address its importance. By implementing the life course theory principles of timing, lifespan, and human agency, more can be achieved to construct an efficient strategy to bring about a positive change. Society needs public health educators and medical professionals to be aware of the situation and strive for improvement in prenatal care and maternal nutrition to promote healthy lifestyles and warn mothers of the risks associated with inadequate nutrient intake. Thank you.